Hello and welcome. This is class 1 of 3 for nurses and aides on the short stay unit. This first lesson is for nurses on the discussion of medication safety. It seems that lately nurses have been falling out of the habit of not understanding why a certain medication is being given. I'm going to share my screen and present a PowerPoint presentation on this. So here are the numbers. There is a risk, about 50% risk for medication errors due to pharmacology knowledge, meaning nurses are not aware of the pharmacology behind the medications that they are giving. There is a pretty moderate and high risk, over 50%, for errors with drug management, meaning we're not handling the medication the way we're supposed to be. We don't understand its uses. We don't understand its dosing. We are not storing it correctly. We're not handling it properly. We're not administering it properly. That is a pretty high percentage for such an important thing. And then lastly, there is a pretty significant, though not as high, risk for errors of drug calculation. So we're being pretty careful with our math, but we are not we're not as careful as we should be. There is still a risk there. Okay, and here it is. 90% of nurses believe that it is important to provide information on medication, yet only 80% actually do. And only a third of nurses actually ask open-ended questions from their patients about the medications that they're giving, meaning that only a third of us actually give the information and explain the information enough to the point so that the patient can answer questions about it. We all know the 5 rights of medication administration: patient, medication, time, dose, route. That's the who, what, where, when, and how. What we're missing is the right reason. We're missing the why. Why are we giving medications? And in the past, that used to be only the doctor's problem, not ours. The doctors were the ones that wrote the orders, calculated the doses. But these days, it's up to us nurses to make sure, we have checks and balances. We have the doctors ordering the medication. We have the pharmacists who are figuring it out and double checking it. Yet we are the final ones. We are the gatekeepers of the medications. We are the ones that actually administer it. We are the ones that are responsible for it. Now, medication review. At the beginning of every shift, a nurse should determine the rationale for each medication for every patient and discuss any discrepancies with physicians. So yes, that is a lot of work. But if it is done on a daily basis, it will be done faster and faster, and nurses will get good at it. Here on the short stay unit, we have a wide variety of problems that we are seeing. We're not just cardiac, we're not just respiratory, we're not just GI. We see a little bit of everything. But that's the thing, is we only see a little bit of everything. So we don't see every medication out there. We don't see the high-risk medications. We don't see the really chronic stuff that they are giving on the ICUs and the GI and respiratory and cardiac floors. What we need to do on the short stay unit is we must look at every medication that's being given. And if something doesn't seem right at first glance, we need to look into it further. A nurse should never administer medication which is unfamiliar to them, which is what I just said. If there's something that just doesn't look right or you're not familiar with, you stop. That's a hard stop. You don't deliver medication that you don't know about. Most of our patients these days are the baby boomer generation who grew up trusting doctors and nurses to know what's best for them, and they do. They don't know what is going on in their history. They don't know what medications they're taking. They just do what the doctors and nurses tell them to. And we need to educate our patients so that they should question everything that they put in their bodies. They should question every test being run. They should know what's going on. A nurse must always be prepared to answer patient and family questions, meaning we have to encourage questions. And if we don't know the answer, if we can't answer the question, then the answer is always, I don't know, but I will find out. The good news is that nurses generally have a positive attitude towards medication education for patients. However, attitudes don't always reflect actions, and nurses are spending less time with patients on medication education than they should. Bottom line is that the nurses, we are the gatekeepers of medication. We are the important hard stop of before delivering medications, of what needs to be given, what needs to be taught. That is lesson 1 of 3. I'm now going to pause the recording and begin lesson 2 in a moment. This is now lesson 2 of 3 on, well, this is now lesson 2 of 3 for nurses and aides on the short stay unit. This lesson discusses personal protective equipment. With the arrival of COVID-19, healthcare professionals are finding ourselves using more and more PPE than we ever have done. And in the past, PPE was used for protection for the patient from picking something up that we may have picked up and spread to them. So, but these days, PPE is being used for our protection from the virus. As the virus can spread very virulently, we must be diligent with our wearing of PPE. The following video shows exactly how to don or put on and doff, meaning take off, our PPE. Okay, the following video has the donning and doffing. I have been having some trouble with audio, so I did include closed captions in case the audio doesn't. This video happens to come through. Okay, that was the video on personal protective equipment. I hope you found it useful. I am going to pause the video before starting the last lesson. Okay, this is lesson 3 of 3 for nurses and aides on the short stay unit. This lesson is mandated for the aides, but the nurses are more than welcome to attend the video as well, because this information pertains to all healthcare workers equally. The Health Insurance Portability and Accountability Act, or HIPAA, mandates certain privacy laws for all healthcare workers. We must be very wary of any conversation pertaining to patient information and the location we're in during that conversation. With social distancing, we've had to learn to speak a little bit louder than we have in the past, sometimes wearing more than one mask, and those masks are a tight fit. So sometimes we have to yell a little bit to be heard by our peers when we talk to them about our patients. However, we need to know that we are doing that in a secure location, and we are not doing it outside of a curtained room where the patient or their neighbors can hear. Gossip about patients is frowned upon and should never be done at all, regardless of location. The following video is kind of short, but it gets the idea of HIPAA across in terms of how easily it is to violate the HIPAA laws and how to avoid such situations. Okay. That is the end of lesson 3. I hope you've enjoyed all 3 lessons. See you again soon.